everyone, welcome back. Today we're going to talk about the veneer process, how many appointments it takes, and what happens during each appointment. Now I know that every dentist is a little different when it comes to their process, but this is the process that I use. It's very predictable. I've been doing this for over a decade, and I have a lot of cosmetic dentistry friends who also have very similar processes. And hopefully by the end you will see why this process makes sense. Before we move forward, if you haven't already, hit the subscribe button so you never miss any of my cosmetic dentistry videos. So I start this process with a virtual consultation. This may actually be the only part of the process that may be very different from other cosmetic dentists, but I find that this is so convenient for people just to get their quotes and just for some transparency as to what they actually need. The way this works is people will go to my website, there's a form, you just fill out your information and then send me a few pictures of your teeth. That way I can take a look and make recommendations based on your teeth and also give you approximate quotes. I actually record an entire video just like this, just like how we're talking, but me looking at your teeth, and I will break down what I would recommend, how much it will be, how many appointments it'll be. I let people know all this stuff all up front virtually, so you do not have to step foot in my office unless you are ready to go. And I honestly think more people should be transparent about their pricing like this. I record these videos every Tuesday, first come, first serve, and in the order that I receive them. So that is how most people start the process. The next step is to start the process and meet in person. This appointment is usually about an hour long. We will start off with x-rays, we'll take pictures and scans, and I will look in the mouth to see if it is possible to do the treatment that I had recommended. Sometimes there are things I cannot see just from a few pictures. So it's always important to verify the treatment and the capability that we are able to do it before we actually start the treatment. That is the purpose of this appointment. But if all goes well with the professional evaluation, we can start designing the smile. I personally love when people bring at least 3 pictures of teeth and smiles that they are drawn to. I always design a smile based on the facial features and what I think will look good on the person. However, I also want to know what they find beautiful. Some people like pointy canines, some people like really square shaped teeth. If those are the preferences, I need to know that before designing a smile. So at this appointment, we will quickly talk about that. And after we take all of the photos and scans, I'll have all the information to design your smile once you leave the office. What I do in the next 2 weeks is make a mock-up with my ceramist of what I think will look good on you. And you can think of that as like the blueprint of where we want to go with this smile. See, this is why my appointments are 4 visits. It sounds like a lot, but really, do you want to come in for your veneers, drill the same day, and then just hope and pray that something good will come back? That's not the way I would want to do it. I would want to know this is the direction that we're going in. And you will actually have an opportunity to try that mock-up in and preview them as temporary. So let's go to the second visit. The second visit is the longer visit. Depending on how many veneers we're doing at that visit, it could be 3 to 5 hours. We're not drilling the entire time, but I have to gather all the information, all the scans, all the photos, because again, I am working with a master ceramist who is off-site, and we will be busy building your smile once you leave. For this long appointment, I say come dressed very comfortably. You will be laying for quite a while, and I will be taking a lot of photos, but these are not photos for social media or anything. These are photos so that I can communicate with the lab, the color, the textures, and we want all those things to be translated into the porcelain. Another few things that we will be doing that I think you should be aware of is that you will be numb. First, we put a numbing gel, then we will numb you. You should not feel pain during this procedure. And if you do, please tell your dentist or please tell me that the numbing is wearing off. That actually brings me to another point. Just communicate really well with your dentist so that things can go very smoothly. Also at this appointment, we will take scans and impressions, and we will make you temporaries. Like I was saying, the temporaries are made based off of the mock-up so that you can preview your smile. Once I put the temporaries in, I will be able to see what they look like on you as well. And we can sort of discuss how we like them. Like for example, do we like the length? Do we want them to be more rounded? Do we want them to be more square? And I will make all of those adjustments directly onto the temporaries, take another scan of those temporaries so that my ceramist knows the direction that we are going in. So again, this is just another layer of communication so that I know that we are nailing this and that you're absolutely gonna love your veneers at the end. Now I know sometimes it's difficult to know whether you like the length or the shape, especially when your lips are numb. So I always always have patients send me a photo once the numbing and some of the swelling goes away. For some people, there is a bit of swelling on the upper lip, not a lot, but it just looks a little bit puffier and it'll go away within 1 to 2 days. In most cases, you can still go to work, you can still go out, you can still do most of the things that you would have done anyway. After that appointment, you can expect your gums to be a little bit tender, but it should be well taken care of with an anti-inflammatory like ibuprofen. The anti-inflammatory will also help with the areas I gave the injections, which may be a little bit tender for a day or two. Now, I will give you very specific post-operative instructions on how to take care of your temporaries, but if you have a water pick or a water flosser, it is very helpful for keeping these veneers nice and clean for the next 3 weeks. You will be wearing those temporaries for around 2 to 3 weeks, and you'll come back to the office for appointment number 3. Appointment number 3 is very, very exciting. That's when you get your veneers cemented. This appointment is much shorter than the other appointment. However, it's still a good 2 to 3 hours. Again, I would advise coming dressed very comfortably. You will be numb again. The first thing we'll do is take off your temporaries. Then we will try in the final porcelain veneers with a try-in cement, not a permanent cement, just so you can see them. I always try to show patients what their veneers look like and make sure that you absolutely love your veneers before we permanently cement them. You have no idea how many veneer revisions I've done where the patient was like, I really didn't like it, but they cemented it. It's like, once it's cemented, it's permanently in. So if there's something that you grossly do not like about the veneers, we want to send them back to the laboratory and not permanently cement them. But at this point, because of this process where people have been able to wear their temporaries for 3 weeks, they know that when they see their veneers, it'll be similar to that, but elevated. It'll be nice and fresh, glassy, and porcelain. So I would say that almost every single time people look at their veneers and they're like, this is what I was expecting. I love them. Let's go. Let's do this. Permanently cement these babies in. So once we get the green light, we will start the process. The cementing process actually moves very quickly. It's just a lot of back and forth between myself and my assistant. What we're doing behind the scenes is preparing the veneers because they have to be prepared in such a way to be bonded to your tooth. So this is all outside of your mouth. Then we prepare your teeth for the bonding, and then we put them on and go through an entire process of cementing them permanently into your mouth. And this part is pretty snappy and fast. The final hour or so is cleaning up all the cement, making sure your bite feels as good as possible, making sure everything feels nice and smooth back there, taking x-rays to verify all the fit, and just making sure that they are the best that they can possibly be. Now, I say possibly because you are still numb, your gums will be tender, so sometimes it's kind of hard for you to tell, but I still do try to get it as close as possible at this appointment. And remember, we have a follow-up appointment if we do need to do any more fine-tuning. And that's it. At the end of that 3rd appointment, you get to leave with your new smile. Yes, you will still be a little swollen just like the first time, and it'll resolve within a day or two, but as the days go by, you will start to learn to love smiling again. And here's a truth that a lot of cosmetic dentists don't really talk about. There is a transitionary period where you have to get used to your new smile. I minimize that by putting you in temporaries that are in the shapes of your finals. However, it can still take a couple of weeks to really get used to and start to love this change about yourself. Even if it takes a couple of months, you will not believe how many patients tell me they didn't realize how seamless this process would be. And a lot of them actually tell me they don't know why they didn't do this sooner because they love it so much, and it was actually a fairly easy process. The 4th and last appointment is the follow-up appointment. This is where we do any fine-tuning with the bite, but really this is the fun appointment. I will get you in some sort of protective device like a night guard or a retainer, because the last thing you want after doing this is for your teeth to shift or to move at all. So I will also deliver that to you at this appointment. But really, this appointment is a fun appointment. We take our final photos with the gums all healed. I'll be able to take your full face photo of you smiling. So come dressed nicely to this appointment. It's mostly just a feel-good appointment where I follow up with you and make sure everything is going well. If you had any residual questions, you could always ask me. If you're okay with it and you absolutely love them, sometimes we have patients do video testimonials of their experience and how much they loved it. Of course, I always leave that up to people because sometimes the video makes people a little nervous, but I always leave it up to the patient. There is no pushing when it comes to that. I'm just always the most happy when a patient loves their new smile. And I see such a change from beginning to end of how patients come into the office. And it's personally so fulfilling for me to help patients gain their confidence back with their smile. I mean, I see such a big change from the 1st appointment to the 4th appointment, and it's just so amazing that a smile smile can really change the way that you show up in the world, both personally and professionally. So I absolutely love what I do, and if you are looking for a smile enhancement, I would love to help you as well. Overall, I hope that this breakdown of my 4 appointment sequence was super helpful for you to get a feel of how the appointments would go and what to expect during your procedure. If you love this video, hit the subscribe button, and I will see you next time. Bye!